Welcome once again to The View from the Summit. Today our guest is Dr. Michael Gruber of Georgia Bone and Joint and one of Dr. Gruber's patients, Mr. Roy Daniel. Dr. Gruber, welcome once again to our program. We are with Dr. Gruber in one of the exam rooms at Georgia Bone and Joint, and our program is going to be very interesting as Dr. Gruber has dialogue today with one of his patients concerning the patient's condition and also future treatment. So Dr. Gruber, we'll let you begin the process of your examination and conversation with Roy Daniel.
All right. Mr. Daniel's been very nice to agree to do this with us, and I thought he'd be an excellent example of something that we have not shown very much on our program, which is joint replacement. Now, we've done a lot of outpatient type procedures. This is obviously an inpatient procedure. And we do a lot of total joint replacements, and we do them at both hospitals. We do them at Piedmont Noonan and Piedmont Fayette. And the nice thing about joint replacement, it's probably one of the more gratifying things we do. It's probably the most successful operation we do. And you're going to take somebody who has a problem that's interfering with their lifestyle and remove that impediment. And Mr. Daniel is an excellent example of that because he has both of his hips affected by his arthritis, and it's been affected for some time. In fact, when did I first see you? It was
in 94, 95.
94, 95. Yeah. I can't believe I've been here that long. But yeah, that long ago. And Mr. Daniel is able to put up with a lot of discomfort. And he was putting this on for some time. How old are you now?
Just turned 48.
48. So, you know, at the time I saw you, being even younger than 40, we try to avoid doing joint replacement in a very, very young person because we know that over time that joint will wear and require replacement. Now, it's interesting in that there's been a great deal of changes since I first saw you. When I first saw you, the implants that we had were good, there's no question, and they lasted probably 10 to 15 years. But there's been significant improvements in hip replacement since I saw you, and so you're going to benefit from that. The biggest improvement in hip replacements, let me grab a little model that I have. The biggest improvement really has been the bearing surface. So a lot of people kind of wonder, well, what's a joint replacement? They kind of think we cut here and put a big hinge in or something like that. But basically what we're doing is a resurfacing. So we're taking that bone on bone. Right now that the ball is worn down to bone, the cup is worn down to bone, and you've got bone rubbing on bone. There's nerve endings in that, and that hurts. And we're going to change that situation into a different bearing surface. Now, the traditional bearing surface is a metal ball on a plastic cup. And so what we do when we do a hip replacement, we go in and we make a little cut in the bone on your thigh side, remove the ball, and we have an implant that goes down the middle of the bone marrow cavity in your thigh bone. And that actually has a coating on it. The one that I use has a coating of a ceramic that the body recognizes as bone and grows to it to hold it in place. Okay. And then there's some sort of ball on the top of that. And then on the cup side, there's a similar situation where we have a porous metal that has a coating on it, and we implant that into the cup. The body grows into that to hold that in place. And then you have another bearing surface here on the cup. And again, traditionally that's been metal on plastic. Now, the biggest improvement in joint replacement probably in the last 10 years has been the plastic. It can be treated now with irradiation, and that binds the molecules together and makes it much tougher. And so we've gotten to the situation where it's almost difficult to measure the amount of wear that occurs over time. And what used to happen when the plastic wasn't so good is that plastic would wear, create particles. Those particles would get in the fluid around the joint. Your body would react to those particles, and it would cause resorption of the bone, and the implant would loosen over time.
Dr. Gruber, may I ask you a question? What made you determine that it was time to proceed with surgery on Mr. Daniel?
Well, he came in and told me he needs a hip, and that's really what the situation is. You know, I see a lot of people with arthritis in their hips, and there's various options for that. And there are a lot of anti-inflammatories.
So he's tried all that.
Lots of different things, right. And really, a joint replacement is a situation where the patient comes in and tells you they need an operation.
They
and
come
that's
to,
exactly what
Mr.
happened
Daniel
right
came
there.
to that point in his life where
That's
he
right.
was ready for an improvement in the quality of life, and so you came to Georgia Bone and Joint, to Dr. Gruber, and you told him what you needed.
Yeah, 'cause he, when I was younger, he told me to hold out as long as I can till I get 50, and then, I turned 48, then it got to where I just couldn't, well, you see how I'm walking. So I decided I'd rather go on and, get it done and get back to a normal life.
Okay, very good.
Now his, he's out of the ordinary. He went with a severe degree of arthritis for a very prolonged period of time, and there's not a lot of people that could do that. So he has a very high pain tolerance. Some people don't have that degree of pain tolerance, and they can't go as long. And the other thing that's changed when I was talking about this bearing surface, what has changed about that is our recommendation for surgery. If a gentleman that comes in who's not quite 40 comes in today and he's having severe pain and he can't do what he wants to do, we're a lot more apt to do surgery now than we were 15 years ago, because we have an implant that we think now is going to last 20 or 30 years because of this improved plastic. And we also have the ability, let me grab this real quick, but we have another bearing surface. A lot of people know this as the Jack Nicklaus hip. He was one of the first ones to have this done. And it's a ceramic bearing surface. So we have a ceramic cup and a ceramic ball. And the nice part of that is that's a very, very slick surface, and there's almost no wear and no particle formation from that. And that's been very, very successful. So in a lot of younger people, we have this option of a different a bearing surface. There's also options of metal on metal. There's other things that are available now.
Well, Dr. Gruber, you've been doing surgery for quite some time, but isn't it amazing just the advancements that have been made since you began your career as a orthopedic surgeon in the implants?
Yeah, it is. The general design on the implant is really kind of stayed the same since I even started, but it's those bearing surfaces that really has been the big difference.
Tell us about you mentioned the surgery. Tell us a little bit, if you would, about the rehab process for Mr. Daniel. How long will it take before he will really know that the quality of his life is improved, and we'll see the change in his walk, and he'll be enjoying life like he hasn't enjoyed it for a long time?
Well, I get that question a lot, is how long is it going to take me to get over this, basically. And so most people are in the hospital about 3 days. After the surgery, we give them the rest of the day off. The next day they're up, they're walking.
Now wait a minute, you've got to be kidding me. The next day after surgery, he will be walking.
The next day he'll be up with a therapist.
Very good.
Most people by day 3 are ready to go home. And what we normally do is we arrange for some home physical therapy. So home health will come to your house and help you get started on your physical therapy. And then after a couple of weeks, he'll be more mobile. It'll be easier for him to hop in the car and go to physical therapy. And so at that point, he'll probably come to some place like Georgia Rehab here. And the advantage of that is that there's just more options. They have a better facility, there's machines, there's different things that they can do at that point.
Dr. Gruber, you raised an issue that I'm very interested in, and I'm sure people of our viewing audience are also interested in it. Roy Daniel came to the point where he said something's got to be done.
Right.
And so that motivated him. The limitations that he had, the pain that he was experiencing, motivated him to come to see you. And that makes it much easier for the orthopedic surgeon and the patient to agree on the form of treatment.
Sure. It does. Again, he's an extreme example.
Right.
Most people that I see, they're coming in, they're just beginning to have some pain in their hip, and there's other things that we can do. And particularly one of the exciting things that we can do for a very young person now who has hip pain is an arthroscopic treatment, which was not really available in the past. I've been doing arthroscopy on a hip for 15 years, but there are newer advances in that, and we've now found that a lot of these people have problems where the cup, their natural cup, is hitting into the area of the ball, or the ball's hitting into the cup, and we can go in and resect those areas and prevent people from having arthritis on down the road. And that's been a really exciting thing that's available. So a lot of people, think, well, I'm 30 years old, there's nothing they can do for my hip. But that's not true. We've got other options now. We have what's called a PAC system, which is a computerized X-ray system here. And this is his pelvis. And this system allows me really, what I love about it is I can doodle and I can really show people what's going on. But basically, if you look at his hips, he has no space here at all. What you'll normally see is a space between the ball and the socket, and that's the cartilage. And he has very little. Right here you see a little bitty line, but that's all that's left. So what has happened over time is that's worn out. The bone has eroded into bone, just like if you took two rocks and rubbed them together. And eventually you get into a situation where the ball is entrapped within that cup and it does not move. And that's why you see Mr. Daniel, as he walks, he has this pattern of gait where he has to sashay back and forth just in order to go forward. And what we're going to be able to do is increase his motion and get him a more normal gait pattern. The other thing that we have available on this PAC system is the ability to use a computer program to fit him perfectly as far as his size. Just like people have different size feet and wear different size shoes, there are different size hips. And on this particular picture, you see this ball here. We have a computer program that knows that that's a 1-inch ball, and we'll be able to get the perfect size and try to reproduce the normal length of his leg. Now he is going to have staged procedures. He's going to have one hip done and then the other several weeks later. And during that interim, the hip that we fix is going to be a little bit long compared to the other, and we'll even him up when we're done. But he's actually gotten shorter over the years as that ball has worn away into his pelvis. So are there any other questions that you have? We're going to do a lot more talking a little bit later. But one of the big questions that everybody has is pain. Is this going to hurt?
Yeah.
Yeah, and that's probably the most common question I get. And we have great ways of taking care of pain with this. What we have available at both hospitals, both Fayette and Noonan, are very good anesthesiologists. Mm-hmm. And what anesthesia has evolved into is a lot of regional blocks. So in all likelihood, you'll have some sort of block that blocks you usually from your belly button down. They give you a little shot in your back. You barely know they're there. This little shot causes this numbness. This numbness continues postoperatively, usually for most of that first night. So very few people have any pain really until the next day. Mm. And then we have ways of taking care of that pain as well. There's medications that we use, both orally and IV, where you can push a little button and give yourself your own pain medicine. Okay. And then, of course, when you leave the hospital, you'll have pain medicine to control your pain. And most people do very, very well. They, certainly have a little bit of discomfort there in the first few days. Mm. Most of that dissipates very quickly, and most people have just mild soreness, really, until, for the first month, something like that.
Okay. Do you have any questions, Mr. Daniel?
Yeah, I always wanted, what he showed about that joint, what holds
the ball in the socket?
Yeah.
Yeah, I get that question a lot. Same things that are holding your ball in your socket right now. It's all those tendons and muscles remain. Now we don't resect those. We incise them. We reflect them. That gives us access to your hip, and then we basically put everything back together as we leave. So it's the same things that hold your hip in right now. Now that brings up technique, and a lot of people do a lot of research on the internet, and they'll see lots of things about minimal incision or double, small incision, and you'll have a small incision. You're a nice thin man. I'll be able to do incision about yay long. Okay. That's about a half to a third of what we used to feel was necessary to do a hip replacement. There are places, if you shop around, they have people that unfortunately now, the way medicine has evolved, there's a lot of direct-to-consumer marketing, and you'll see people that talk about minimal incisions, and there's been some findings that you might get out of the hospital a day earlier, but there's been some major complications with those. So we do basically this surgery using the latest techniques, but a fairly traditional approach to placement, and that's been shown to have the best long-term results. And what you're interested in is, how's this going to do the rest of my lifetime, not can I get out of the hospital a day earlier. Yeah. So anyway, I hope that answered your question.
Yeah. Okay.
Have any other questions?
Oh, that's it. I'm just ready to
Okay.
get it over with.
Well, I know that it's going to be an experience for you that's going to improve the quality of your life, Roy Daniel. And I want to thank you for being with us today on The View from the Summit. I am grateful that you found an outstanding surgeon like Dr. Gruber who's going to be taking care of you. And after surgery, I'm going to visit you in the hospital and check on you and encourage you. And Dr. Gruber, thank you for letting us visit with you today at Georgia Bone and Joint. And we are going to be back with Dr. Gruber and Roy Daniel. Are we going to wait till after you do both the hips? Or are we going to do a program after the first one and then maybe a follow-up on the second?
Well,
because
yeah.
it's very, very interesting for our viewing audience to have the opportunity for you to allow us in this room to actually visit with a patient, because we possibly have people that are viewing our program today that are saying, hey, I put it off long enough. I need an implant, a hip implant, and so it's time for me to go see Dr. Gruber.
Well, we'll see how it goes. The dramatic difference is going to be from today and after his second surgery. And he being as healthy as will be able to put those two surgeries together fairly soon after one another. So probably that's the big unveiling is after that second surgery.
Well, we'll look forward to seeing you again after the second surgery, and you'll see the complete program at that time. Thank you once again for giving us an opportunity to visit with you today, and we'll be back with the second half of our program after this word from our sponsor. The second segment of our program today is going to feature Dr. Michael Gruber and Mr. Roy Daniel, following the surgical experience of Mr. Daniel. Mr. Roy, I saw you walk a few moments ago, and I really couldn't believe it. There's really been something amazing taking place as a result of the surgery that Dr. Gruber performed on you.
Yeah, I can tell. I can tell a big difference from when I first came in. My flexibility and everything better.
Dr. Gruber, I know that this has got to be a tremendous experience for you as a surgeon when you see the kind of results that you've had with Mr. Roy Daniel. So tell us, if you will, about the surgical procedure and the follow-up.
Well, what we do when you have a hip replacement, basically what we do is we're resurfacing the joint. And so what we did is go in and we remove the ball that was diseased and worn, and we have an implant that goes down the middle of the thigh bone. And to that is a new bone, a new ball. A new ball is attached to that. And then on the cup side, we replace his cup with a metallic cup that then has a liner in it. And what he got was a ceramic on ceramic implant, and this is kind of the latest and greatest in implants. A lot of people hear this called the Jack Nicklaus hip, because he was one of the first ones that had this. But the nice part of this is we think it's going to last a long, long time. What we've been looking for is an implant that's going to last someone's lifetime, and this probably will. It has a lot of advantages over the old implant, in that the old implant made of plastic sometimes would wear, and the plastic would wear out, and we'd have to redo the implant, 10 or 15 years down the road.
How long have you been doing this procedure with the plastic?
Well, with the ceramic?
I mean, the ceramic, I'm sorry.
I guess the ceramic's probably been out about 6 or 8 years, something like that. And we've done dozens of these and really haven't had any trouble with them.
Now, I believe you did a double with Mr. Daniel, both hips. Is that correct?
Well, we did them sequentially, right. We didn't do them at one sitting, we did them sequentially. It's a rare situation where we would do both hips. I have done that, and we've done it successfully. We did it in recently in a lady who was in her 40s, had disease of both hips. She's a former gymnast, still an athlete, did great having both of them done at one time. But that's really a difficult undertaking to do both at one time.
When Mr. Daniel came to you, and we covered a little bit of this in our previous program, but tell us what determined, in your mind, the need to do both hips?
Well, he needed his hips done years ago. He came in to see me, 15 years ago or something, when I first started in practice, and really he was at the point where he probably needed hip replacements then, but he's a pretty stoic gentleman. He was able to get by for a long period of time. And I think you finally decided to come in when you just really couldn't walk about and do what you needed to do. There are a lot of people that would come in much before that. What usually determines when people, first of all, I usually don't say, hey, you need a hip replacement. People come in and say, hey, I need a hip replacement, because they have pain during the day. It's interfering with what they need to do. It may awaken them from night when they're having that pain. And so really it's the symptoms, it's not so much what we see on x-ray that determines when it's time.
Well, Mr. Daniel, you were rather limited before you had the surgery, is that correct?
Yeah, that's correct.
Let me ask you this. Tell me how the surgery has improved your quality of life, because I saw you walk down the hall a few moments ago, and I was amazed at the results of the surgery, because the outcome has just been very, very positive. It's been a great outcome. And share with our viewing audience, if you will, how this has improved your quality of life.
Well, it done changed my life, the way I get around, and I had not got to where if I walk in a store or something, I didn't want to see my reflection, you know, in the glass or mirror, because I know I was walking funny, and really want to just stay at home. Then now I'm out cutting my grass.
Well, let me interrupt you just a moment. So having the surgery and the change in your walk has really made you feel so much better about yourself.
Yeah, my confidence and everything, you know, is back up. You know, I don't mind getting out and, you know, doing things. The other day I was cutting my grass, and my little granddaughter, she 8 years old, and she hadn't never seen me run or play with anything like that. And she was out there picking at me. All of a sudden I stopped the mower, went to chasing her, and that was so funny to her, she almost fell, you know, running.
She had never seen her grandfather run and never had the opportunity of having you go outside and play with her.
Yeah.
How did that make you feel?
That made me feel good. I feel a whole lot better. I really appreciate what Dr. Gruber did for me.
Well, Dr. Gruber, that's got to be very fulfilling to you as a surgeon. And one of the things that amazes me, not only with Mr. Daniel, but with other patients, successful surgery not only takes care of the physical needs and improves a person's wellness of body, but it has a lot to do with emotions. It has a lot to do with how they feel about themselves. And I know you've seen that progress made throughout your years as a surgeon, the wellness of the total person as a result of successful surgery. Would you comment on that, if you would?
To be able to restore someone's lifestyle is really rewarding. And I know Mr. Daniel in his past has been a good athlete. And, you know, to lose that ability, to lose that mobility, and then to regain it, I think, you know, it's exciting to be able to give someone that. And, you know, there's a lot of things that we do that help people, but I think joint replacement is one of the most rewarding, because it really does restore their lifestyle.
I'm sure that there are those viewing our program who are considering this type of surgery. If you will, take a moment and talk with us about the recovery time. The surgery is over. The surgery has been successful. What about the post-operative experience?
Well, you know, I get a lot of questions. Well, you know, how long does it take to get over it? And you in the hospital about 3 days. And then for most people, they can go home. We arrange for home health.
How long before they're up in the hospital?
They're up the next day. So we usually give them the rest of the day off, the day of surgery.
Right.
And then the next morning, the therapists are in there trying to get them up. They venture around the room, get up to the chair. The next day, they're up walking in the hall, and usually they're ready to walk home the next day. Now, most people are on a walker for a while. Most people choose walkers rather than crutches, but sometimes some folks use crutches and use that for a variable amount of time. Some people a month or more, sometimes just a couple of weeks. I've had people walk in at 2 weeks really using nothing. That lady that I mentioned that we did both hips, she came in carrying her walker at 2 weeks. So most people are out and about and doing most of their daily activities out of the home within 3 or 4 weeks. And then by 6 weeks, most people, you wouldn't really know they had a hip replacement if you saw them walking down the street. They're probably 80% over it, and then by 3 months, they're pretty close to 100% over it.
When was your first surgery? How many months ago?
Oh, March the 12th.
Okay, that's about 6 months.
Mm-hmm.
And then what was the time period between the first and second surgery, Dr. Gruber?
What was it, about 3 months difference? Or we might have moved you up a lot.
I think like
sooner.
10 weeks.
10 weeks.
So you have the complete healing and the rehab of the first surgery before you do the second surgery?
Yeah, in most cases. Most people wait, right around 3 months.
So I know, Roy Daniel, that as you speak to our viewing audience today, that if there are those who are considering having a hip replacement, that yours was successful, and you would encourage it because it certainly does improve the quality of one's life.
Yeah, if you know, it's nothing like getting rid of the pain. You know, if you got need a hip replacement, knee replacement, or something, you know, go on and get it done. It ain't as hard as you think it is. You know, that's what will bother me. You know, but you go get the surgery done, the pain you had be gone. You just have soreness from your surgery, and then in, you know, a few weeks that'll be gone.
And then when you're out in the yard playing with that beautiful little granddaughter, and she's running, and then all of a sudden you discover that you're running,
yeah,
and she's laughing, that makes the pain that you experienced, it makes it worth it all, doesn't it?
It sure do, man. It's, you know, I really can't explain it. You know, I really feel good.
Well, we're so excited about it. And Dr. Gruber, what's the prognosis for Roy Daniel from here on out? Does he have any limitations?
Well, there are a few. You know, you mentioned the running. And
yeah, tell us about. I was a little concerned about. Okay.
As far as after you have this type surgery, we try to limit high impact things. So running, jumping, things aren't necessarily encouraged.
So walk real fast.
Yeah, if you're chasing a granddaughter for a short period of time, that's a different story than going out and running for fitness. But
not doing a 10K.
A lot of people, you know, ask, well, what can I do after a hip replacement? And you can bike, you can Stairmaster, you can elliptical train, you can walk all you want. You can be very, very active in relatively low impact activities.
Well, we were talking about the football season opening up very soon, and it's time for football, but there's not going to be any tag football or touch football or flag football for Mr. Daniel. He's just going to enjoy the game, right?
Right. If there is, I don't want to hear that.
You know, we want to tell Dr. Gruber about it, okay, Mr. Daniel?
All right, that's okay with
I'm
me.
sure people do a lot of things I just don't hear about.
Right, so we'll keep that from him. On behalf of Georgia Bone and Joint and all the people here at the Summit Healthplex, I want to thank you for being a part of these two programs. You have been a superb patient, and we want to wish you the very best in the days ahead. Dr. Gruber, any last word of the summary or the encouragement that you would share with people who are having problems with their walking like Mr. Daniel was having? Where to from here?
Well, I'd encourage people to come in and get evaluated, and the answer is not always a hip replacement. You need to know that. I mean, there's a lot of other things that we can do. We even do arthroscopy on hips now, so we're able to, whereas in knees, a lot of people are familiar with that. We can go in and trim out a little cartilage damage, that kind of thing. Well, that's available in hips as well, and sometimes that's the answer rather than a replacement.
We want to take this opportunity to thank you for viewing these programs. This has been an interesting journey for us with Mr. Roy Daniel, with Dr. Gruber. Dr. Gruber is one of the outstanding surgeons here at Georgia Bone and Joint, and by viewing our program, you can see the success of the surgery on Mr. Roy Daniel. And Mr. Daniel, we wish you the very best in the days ahead. Just be a little careful when you're running, when you're playing outside with that granddaughter, but continue to enjoy her, and we wish you the best of health and the best of blessings in the days ahead. And Dr. Gruber, thank you for taking time out of your busy schedule to do this program with us, and I'm sure that it has been helpful to a lot of folks. So if you have orthopedic needs, come to Georgia Bone and Joint, and I assure you that those needs will be met. Once again, this is Gene Tyre thanking you for taking the time today to view the view from the summit. And I would encourage you to remember that you control your healthcare destiny.